Mr. Chairman, ladies and gentlemen, my name is Richard Baker, and 6 years ago I founded an organization to help Canadians who are on long medical waiting lists to get timely care in U.S. hospitals. Now, currently there are over 750,000 Canadians who are waiting for surgeries, which Americans routinely get in days. In some parts of Canada, the waiting time for an MRI, for instance, a very routine test, the wait is over 1 year to get an MRI, a basic diagnostic image. The Canadian Supreme Court has admitted that people are dying on waiting lists in Canada right across the country. Over the years, my organization has sent well over 500 Canadians to the U.S., and we refer to the U.S. as Canada's healthcare system of last resort. If you are dying, if you cannot get care, there is always the option to go to the U.S. 2 years ago, building on our success and our experience, I founded North American Surgery. This company negotiates deeply discounted pricing for surgical procedures for uninsured Americans. In the course of this work, we have saved the lives of 6 of our fellow Canadians. We never had the opportunity to work with Shona, but I will tell you some of our other clients whose stories I believe are compelling. We helped an 8-year-old girl who had a massive cranial infection. She was on a 15-month waiting list in Canada to have the most simple of surgeries. She needed drains put on her ears to drain off the infection. She needed her tonsils out, her adenoids out. This is meat and potatoes surgery. This is the simplest possible surgery, and yet she was on a 15-month wait after having gone deaf in January of 2004. Couldn't hear her teacher, couldn't participate in school. In month 9 of the 15-month wait, we sent her to a surgeon in Seattle who told her father that had she waited for the 15 months that she was asked to wait in Canada, she would be dead. He said, never mind her hearing. He said, my job now is to try and save her life. Happily, this surgeon did save her life. This little girl lost all of her hearing in one ear, half of the hearing in the other, for want of drain tubes in her ears and tonsils and adenoids. Our client, Lindsay McCreath in Toronto, was diagnosed with a brain tumor in 2006. His family doctor estimated it would have taken 7.5 months from the time he collapsed on the street until he would have finally got his surgery. That included a 4.5-month wait for an MRI image to confirm the initial diagnosis of a brain tumor. We sent him down to Buffalo, New York, where he had a malignant brain tumor removed, a grade 2 astrocytoma. We compressed the 7.5 months into 4.5 weeks. Mr. McCreath had his first hearing in court yesterday. He's gone to the Supreme Court. He's suing the Canadian government for violation of his charter rights, specifically the charter right of security of person. It would be ironic if, just as Canada appears to be going more to the right on health care delivery, the U.S. would be copying the Canadian system and going to the left. It would be very ironic. Our client, Shirley Healy in Vernon, British Columbia, was told by her vascular surgeon that she had 2, maybe 3 weeks to live due to a blocked mesenteric artery. She was starving to death. She could not digest her food. She lost 40 pounds. Shirley's surgery was planned in Kelowna Hospital in British Columbia. She was on the table being prepped for her surgery when the word came down that all elective surgeries were to be canceled for the day in this hospital. This is a routine procedure in Kelowna. They don't have sufficient beds. Had Shirley had her surgery, there would have been no bed for her to go to. Why are there no beds? Because they don't have enough money to hire nurses to tend to the patients in those beds. So Shirley waited. her second surgery the following week was canceled. Her surgeon said, get in touch with Timely Medical Alternatives, which is our organization. They will help you to get care in the U.S. Next day, Shirley was at an excellent hospital down in Bellingham, Washington, where her surgeon said, Shirley, you were hanging by a thread. You had less than a week to live, and he saved her life. Shirley went back. This is an important part. Shirley went back to Canada. She went to the government, said, I'd like to have my money back, please. They said, why would we give you your money back? She said, because there's an implied contract. I've been driving a school bus all my life. I've paid crushing taxes all my life, the implication being that when I needed health care, it would be there for me. It wasn't. I had to pay out of my own pocket. I want my money back. And the Minister of Health said, Shirley, your decision to leave the jurisdiction was an elective decision. Your application is denied. By the way, Shirley's response to that comment was, the only thing elective about my decision to go to the U.S. was that I'd elected to keep on living. That was a great quote. Again, there are 750,000 Canadians waiting for elective medical procedures. One of these is our client, Lynn Gilbert from Vancouver. Her son needs a major spinal surgery. He's only 15 years old. He needs a lumbar fusion. Lynn herself needed the same surgery when she was 15. She did not get it. By the time Lynn was 28, she couldn't pick up her two babies. She couldn't hold down a job. She was walking with a walker. She was addicted to morphine. And worst of all, in my view, she had to walk around all day in diapers, age 28, a mother of two, walking around in diapers. She said to her surgeon, when can I get my surgery? He said, well, you're too young to have a spinal fusion. Now, life had come to an end, or a stop. She was too young to get spinal surgeries. Besides, he said, there are so many others waiting in line behind you. Ahead of you. There's hundreds of people ahead of you whom we have to operate on first. And besides, Lynn, he said, you have not yet suffered long enough. I want you to remember that phrase. You have not yet suffered long enough. A 28-year-old mother of two with diapers, addicted to morphine. That's the elective healthcare system in Canada. When she was 31, 3 years later, she finally got her surgery. She came to us 2 weeks ago to help her get surgery for her son, who has the same familial condition. She told us she would pay anything. She would mortgage her home. She would sell her home. She would do anything to avoid having him go through the same suffering that she went through. You will hear from prominent Canadians on the left of the political spectrum about how wonderful the Canadian healthcare system is. Jack Layton, the leader of the Socialist NDP party in Canada, recently came to Washington to tell you folks how wonderful the Canadian healthcare system is. Why would he do this? Why would he care? Here's why he came. The only reason Canadians put up with our dysfunctional healthcare system is the fact that the government tells them that ours, the Canadian system, is the best healthcare system in the world. However, when Canadian citizens are willing to pay to get timely care in the U.S., even though it's free in Canada, people begin to question the government's propaganda. It's inconsistent that they would pay to go to the U.S. if they have the best healthcare system already that's free. Why would they come to the U.S.? Now, if the Canadian and American governments can arrange things so that both countries have single-payer health care, then the freedom train that my company operates for Canadians will have no place to send our Canadian clients. And that's why I'm here today. Americans need to know the truth about the strengths and weaknesses of both healthcare systems, and with 6 years of experience working in both systems, I have, I think, a unique insight into the subject. Now, in conclusion, as you Americans work to create new laws to govern the delivery of health care in your country, you should know that the Canada Health Act in my country, which governs the delivery of health care, has caused more pain, has caused more suffering, and has caused more death than any other piece of domestic legislation in the history of Canada. I thank you.